No doubt that the coronavirus pandemic has left people around the world stressed, devastated and feeling hopeless. From dealing with illness, death and job losses, it really has been an incredibly difficult time. To discuss this further, I'm joined by Professor Saths Cooper, the President of the Pan-African Psychology Union. Very good evening to you. I should imagine that this is not going to be good news, I mean, for many people in South Africa, but particularly those who suffer from extreme depression during these times.
Yes, I think that if you have any of those conditions that you've mentioned, the likelihood of you taking and having more mental health problems will be higher. But we need to recognize that human beings are very resilient, and if we learn to cope with stress in a healthy way, it will make us and the people we care about, those around us, become also more resilient to deal with these unprecedented and trying times.
And how do you cope with stress on a better level? What should people be doing if they're concerned?
Well, there are ways to deal with it, such as taking breaks from persistently looking at social media, following certain excitable trends that have no basis, fear-mongering and so on. I mean, it's important to stay alert and be on top of the latest news, but to constantly subject yourself to ill information and those who may be more stressed than you are, and the purveyors of fake news, those who would want us to be excitable and not do what we should do, can create a laxity, can create an obduracy to issues that we need to deal with. On the other hand, if you are fairly compulsive and if you're fairly vigilant, not paranoid, but if you're fairly vigilant and you have developed over the last 15 to 16, 17 months now, certain hand washing, certain sanitizing, certain mask wearing, physical distancing from others, then those are good traits to have, because ordinarily, if we maintain that, except in your own bubble, we will be better off even without the pandemic. But taking care of your body, understanding what your body needs are, doing simple things like deep breathing exercises, stretching, having personal quiet time, eating healthily, exercising, getting plenty of sleep, avoiding excessive alcohol, tobacco, substance abuse, but importantly, continuing with as much routine as one can, and also retaining preventative measures such as immune boosters and taking the vaccine. We shouldn't be listening to anti-vaccine vaxxers out there, however high in office they may be, whether they are judges or lay people. And we should remember that in the UK, we're probably one of the countries that had a high anti-vaxxer attitude before this pandemic. The figures have dramatically come down once vaccines were made available, and that has dropped now from probably about 38 to 40% to less than 10%. And their population is larger than ours, and they have more adults vaccinated than the 2.7 million that we have recorded thus far.
I mean, I agree, and we totally support you on that. I mean, everybody must get vaccinated as soon as possible. I mean, what is it that you saw in the last lockdowns? What sort of mental health issues did you see, and what did you learn from that period that we can take into this period? I mean, other than what you were telling us about how to be a lot more positive if you can, but the bad news is relentless. You can't get away from it.
No, and the important thing to remember is every one of us is similarly impacted, some to higher degrees, but we are all facing this pandemic. There's no point in denying it. There's no point in acting as if one is beyond this or appealing to one's God, because God is not in the habit of intervening in the lives of 9 billion people out there. So what we see is an increase clearly in depression, the loss of loved ones, the loss of interaction that we used to. We're human beings and we socialized. We become human through other people. And that inability to do those things increase our sense of insecurity and hopelessness. There's also the fear of infection. And it's a good fear, because if you remain close to people, and if there are callous and dangerous people who refuse to wear masks, despite the good that can come out of being masked in public spaces and outside your door, then they are guilty of actually condemning us to whatever fate we are now seeing. And we should recognize that we've had wave after wave, and just wishing it away is not going to help us. So there's also greater cogitation. There's more rumination. We're going to be thinking more inwardly. And often we're going to express quick anger, irritability, and a degree of fear and frustration. There can also be, on the other hand, a degree of numbness, a degree of strangeness that can overwhelm us. And the result can be increased decrease in appetite. The same with energy and other desires and interests. We'll have difficulties in concentrating. I think that in these conditions now, those of us who work in the kinds of spaces we do, especially upper middle and upper class people, professionals, will be much more alert and giving attention to online and other kinds of activity. And the result is we may not take the necessary breaks. Well, I think employers will are getting more from us. So we need to pace ourselves and ensure that we ask and take the breaks that we deserve.
Okay,
But
Professor, let me just jump in here quickly.
We look after
if you're concerned about the way you are, your mental status, or somebody else around you, what should you do? Where can you go?
I think there are many helplines out there. There are good ones that are well known in our society. A phone call away. There are, the lifelines of this world, the Psychological Society, and there are online facilities. The medical and other health professionals are putting out. One just needs to go online or on your device and get the necessary help from professionals who are trained to deal with the feelings that we are unable to come to terms with, and particularly in these unnatural times.
Okay. Thank you very much, Professor Saths Cooper.